I see patients in my practice all the time who think they have terrible skin. But many times, it turns out that their skin problems are actually caused by user error. In fact, many issues are the result of everyday habits that they didn't even realize were harmful. Let's look at some of those habits that may seem harmless but are quietly wrecking your largest organ. Huge thanks to Bioderma for sponsoring this video. Stop rubbing your eyes when you're tired. Not only is this problematic for your eyes, but repeated friction to the thinnest skin on your body causes irritation and microinflammation that can worsen dark circles and speed up fine lines. It also spreads bacteria that can trigger styes and blepharitis. Who wants that swelling? Overindulging in hot drinks or spicy foods when you have rosacea. Both can dilate blood vessels and flare up your redness. And if symptoms don't resolve, know that medications and an assortment of treatments are available. Sleep debt and chronic stress, two of my best friends. Poor sleep and elevated cortisol impair barrier repair and ramp up inflammation. Aim for 7 to 9 hours and keep a consistent schedule. Get a really good wind down routine with no phones. Towel rubbing your face with yesterday's towel. Friction plus bacteria is not a glow up. It's a recipe for impetigo. Pat dry with a clean towel or let your face air dry before applying moisturizer. Mixing too many actives all at once. It may feel like your hyper combination product is good bang for your buck, but it's no bueno for your barrier. Benzoyl peroxide, retinoids, AHAs, BHAs, vitamin C, stacking them all in one routine usually breaks your barrier. Keep it simple. One active in the morning, one at night. For example, vitamin C in the morning, retinoid at night, and using benzoyl peroxide or salicylic acid as a spot treatment or at least on alternate days. Walking in gyms, spas, or public pools without sandals. Moist public areas are a breeding ground for skin issues. Know that it is well documented that those who do have a significantly higher risk of getting warts, fungal, and bacterial infections. Over scrubbing with loofahs, body brushes, and exfoliants. You don't need to sandblast your epidermis. This creates micro tears and ramps up irritation and eczema flares. Hands beat hardware. Exfoliate the body once or twice a week max. The face even less unless a dermatologist told you otherwise. Hard water in your shower, meaning lots of calcium or magnesium. It makes cleansers stick to your skin, raising pH, which weakens the barrier and lets more water escape so you feel tight and dry. Lab studies actually show washing with hard water leaves more detergent residue on skin and increases transepidermal water loss, especially in those who are prone to eczema, like me. Spritzing perfume on the neck and then heading outside. This is a unique one called phytophotodermatitis. Perfumes that contain citrus or bergamot oil can react with UVA when sunlight hits it, and you end up with a reaction that first reddens and then leaves streaky, darker patches exactly where you sprayed. This has been given a fun nickname, margarita dermatitis, from squeezing limes during summer parties and then being exposed in the sun. Stick to spraying your perfumes onto your clothes rather than your skin. Dry shaving or using old blades. That just invites nicks, razor bumps, and ingrowns. Shave at the end of the shower when the hair is at its softest. Use a slick shave gel and swap blades every 5 to 7 shaves. Now, shaving against the grain is what some people say. That's terrible, causes irritation. And to find out which direction your facial hair actually grows, pull the skin tightly while looking in the mirror and you're gonna get your answer. Marinating in sweat after a workout. Occluded, sweaty skin is a recipe for folliculitis and body acne. Especially with polyester workout gear, not only does it get stinky, but it can also cause meme conditions like intertrigo and jock itch, so rinse as soon as you can. And if you can't shower, at least do a quick wipe and change into dry clothes. Gel manicures usually mean sticking your hands under UVA lamps, and yes, even LED dryers can still emit UVA. These are the UV rays we warn you about from the sun. But if we're going off of evidence, real-world cancer risk from occasional use appears low, but UVA is a known skin ager and in vitro risk remains high. So perhaps if you love glossy nails, try alternatives that air cure and skip the light altogether. If you choose to use a lamp, protect your skin. SPF on the hands or fingerless UV blocking gloves. Skipping sunscreen on cloudy days or while indoors. news. UVA rays penetrate clouds and windows and are major drivers of photo aging and skin cancer. The fix here, broad spectrum SPF 30 or higher every single morning. Use the 2-finger rule for the face and neck and reapply every 2 to 3 hours if you're spending time outside. Oh my God, and please don't neglect the ears, lips, scalp. Skin cancers love the spots we forget, and no, makeup on its own is not skin cancer protection. Constant high sugar, ultra processed snacking. Frequent glucose spikes caused by those excessive added sugars can dull the skin. This happens by glycation, and it can even worsen acne for some people. Think more fruits, veggies, less ultra processed sugary snacks, favor whole foods, and hydrate. Over enjoying your pillowcases. That sounded weird. They collect oil, product, and dead skin. So swap pillowcases 2 to 3 times a week and stay away from those bed linen sprays. If you're sensitive, make sure that you're using an appropriate detergent that's targeted for that task. Driving. Well, not actually driving, but cranking the car heat and AC directly at your face really dries out your skin and mucous membranes. And while we're on the topic of cars, keep the driver's window rolled up, for you can literally see skin aging on the left side of those who drive for a living. While the windshield does a better job at blocking UV rays, side windows still cut the exposure pretty significantly. I'm a fan of humidifiers, but a dirty humidifier can spray tiny microbes and mineral white dust into the room. Those particles settle on your skin and can irritate or worsen dryness. Aim to keep the humidity in that sweet spot, about 30 to 50%, and maintain the unit. Empty daily, clean every few days, and use distilled water, because over-humidifying, contaminated tanks, and mineral-rich water promote mold and dust mites, which are well-known eczema triggers. Retinoid misuse. I see this so often. Starting nightly, using way too much, and quitting during the purge is classic. Go slow and low. Start every 3rd night for 2 weeks, then every other night, then nightly if your skin tolerates it. A pea-sized amount is enough for your whole face. If you're sensitive, you can buffer with a moisturizer. Whey protein every day when you're acne prone. Now, whey protein doesn't trigger acne for everyone. In fact, a randomized controlled trial found no overall worsening of acne, but some people do seem to break out more after starting it. And there's a biologically plausible mechanism too. If you notice a pattern, try a simple 4 to 6 week swap to a non-dairy protein, pea, soy, egg, and see if your skin calms down. This is low risk and will give you a clear signal. Blasting your face and hairline with a hot blow dryer. Heat and airflow increase water loss from the skin, period, end of story. So keep the heat low and the dryer farther away so your skin and hairline can thank you. Hair products migrating onto your facial skin. Pomades, waxes, and thick stylers can cause forehead and hairline acne. So apply away from the hairline, wash your face after styling, and look for non-comedogenic options. Nickel in headphones, watch backs, and jewelry. You're dealing with itchy, scaly patches in random, really specific spots. Check if that's where the metal touches the skin and consider a nickel allergy. This always makes me feel like I'm Sherlock Holmes to my patients when I make that diagnosis. Just go nickel-free or use a barrier where skin contact occurs for the solution. Long, super hot showers. Yes, they can feel amazing for your muscles, perhaps your soul, but they strip away your skin's natural lipids so water escapes and you're left tight, itchy, and flaky. Flaky. Instead, use warm, not hot water, keep it under 10 minutes, and moisturize within 3 minutes of stepping out while your skin is still damp. The right product to use in the shower matter too, especially if you have atopic or eczema-prone skin like mine. You heard me praise my partner Bioderma before, but this is where their products really shine. Everyone, including my own family that I've recommended the Atoderm line to, has fallen in love with it. The shower oil is gentle and packs skin-friendly ingredients like glycerin and niacinamide. I never thought I'd be showering using oil, but it cleans so well and leaves my skin feeling luxe. Then it's important to lock in the moisture with the Intensive Balm. It's rich in ceramide type and biomimetic lipids that help rebuild the skin's protective layer. I literally recommended that this duo be part of their Stronger Together kit because of how well it worked for me and my dry atopic skin. And now both products are available for sale on Amazon. I've reacted to the worst skincare TikToks before also. Click here and check that out. As always, stay happy and healthy.